Okay, hello. Good morning. My name is Martha Gonzalez. I'm going to perform a physical pre-employment health screen for Miss Tina Jones for the class of advanced physical assessment, advanced assessment with Aspen University and Professor Dennis Pattinson. So we are going to start. This is our patient, Miss Tina Jones. I'm going to start for the greeting. Apparently the system is not allowing me to use the microphone. Good morning. My name is Martha Gonzalez. I am your nurse today.
Hey.
Hello. Okay. What brings you in today?
I came in because I'm required to have a recent physical exam for the health insurance at my new job.
Okay. Please tell me your name and your date of birth.
My name's Tina Jones, and my birthday is February 17th.
Thank you. What is your age?
I'm 28.
Thank you. Okay. I'm going to start with the vitals. Blood pressure 128/82. Heart rate 78. Saturation 99%. Room air. Respiratory rate 15. Okay. What is your height?
I'm around 5'7".
And what is 100. Sorry, that's centimeters. And your weight. What is your weight? No.
I've lost a little weight. I'm at around 185.
Okay. Hmm.
I'm going to be an accounting clerk at Smith, Stevens, Stewart, Silver and Company. I'll be helping a more experienced accountant with her clients. And then eventually I'll get more responsibility and build my own client list. I start in 2 weeks. I'm really excited.
Hmm. I can see that. Congratulations.
Thanks.
Hmm. All right. Mm. Okay. Have you been sick lately?
No, the last time I was sick was when I was having those heartburn problems a while ago.
Hmm. Okay. What medicine did you take for heartburn?
Well, I was prescribed Zantac after I came in with the heartburn or whatever it was, and it seemed to work. I'm not taking it anymore, though.
Mm-hmm.
Thanks.
Hmm. Okay. Any new medication?
Yeah, I'm taking birth control, metformin, a daily inhaler, and I still have my rescue inhaler, though I don't use it that much.
Hmm. What is the dosage of metformin?
I take it twice a day, and it's 850 milligrams. I knew doctors would want to know it, so I memorized it.
Thanks. That is helpful. Hmm.
Thanks.
How is your diabetes? Hmm. What happened? How is oh, your diabetes?
I've been doing really well with my diabetes lately, actually.
Okay. Do you monitor your diabetes? Oh. Mm-mm. Oh boy, oh boy, oh boy. I wish I can talk. Okay. How do you manage your diabetes? How do you manage your diabetes? It's not going. All right.
I take metformin, and I check my blood sugar once a day. Plus, I've changed my diet, and I'm exercising more.
great news.
Thanks.
The best way to control diabetes is to monitor your glucose levels daily.
Thanks for telling me.
All right. How is your asthma?
My asthma has been so much better ever since I started using my daily inhaler. Like, I can't believe I lived so long with the breathing problems I was having. I didn't even realize how bad they were until they went away, you know?
Yes, I understand. You feel better now that you can breathe without asthmatic symptoms of asthma.
Thanks.
When did you started taking birth control pills?
About 4 months ago, I went to the gynecologist and she prescribed it. It's been a while, but I actually have a boyfriend now. We haven't had sex yet, but we probably will soon.
That's good. That's good for you.
Thanks.
Are you planning to move from your mother's house?
I'm still living at home, but I'm actually going to be back in my own place in about a month.
Another good news.
Thanks.
Oh. Have you tested for STD? Have you been tested?
Yeah, I'm sure they did those tests when I went in for a pap smear before.
Okay. Are you planning to use condoms?
We'll use condoms for sure. I know he's been tested pretty recently, and it was clean, but I want us both to get tested again before I think about not using condoms.
A recent test of to rule out STDs and HIV are the best way to feel confident about starting a new consenting adult relationship.
Thanks for telling me.
Okay. All right. Let's see. How do you see your health right now?
I'm doing really well, thanks.
Okay. Do you have any problem to access medical care? Okay. Do you have any more of those headaches? Oh, any.
I used to get them a lot when I was studying, but I haven't had any problems in a while.
Mm-hmm. Okay. Okay, when was the last eye vision checkup?
I hadn't gone in a long while, but I went 3 months ago. She tested my vision and prescribed these glasses. I'm supposed to go back next year. Thanks.
Hmm. When did you go to the dentist?
I finally went in 5 months ago, actually.
All right, let's start. Hint. Let's start with the head. Symmetric, normal cephalic, good distribution of hair, no balding spots, good hair texture, clean hair. Inspecting the eyes. Right eye, clear, white and sclera, no whitish. Left eye, same position, center, clear, white sclera. Back. Inspecting the mouth. Moist pink, no lacerations, no bleeding, no swelling, no infection, no dryness. Depressing the tongue. Back of the throat, pink. No lesions. Pull up the tongue. Same, no lesions, no cracks, no fissures, no signs of infection. Pushing the tongue to the left, pink, moist, no fissures, no lesions. Pushing the tongue to the right, no pustules, no infection, all no cavities, good dentition. Testing the gut reflex, positive, perfect. Now the eyes, checking the eyelids, upper eyelids up, pink, moist, no irritation. Eyelids down, pink, moist, no irritation, no discharge, perfect. No yellowing. Inspecting ears, symmetric, center, okay, back, palpating the scalp, palpating to find if there is protrusions, bumps, balding spots, any pain on your head.
No.
Okay. Palpating the cervical lymph nodes. No protrusion, no bruit. There was no problems with the lymph nodes, no swelling, no palpable lymph nodes. No sign of infection. Palpating the thyroid and testing for swallowing reflex. Palpating the thyroid, which is smooth and without nodules, no goiter. Trigeminal, the jaw. Open and close your mouth. It's not doing it. Okay, open and close your mouth. Oh. So no clicks and full range of motions for the trigeminal and the jaw. Palpating the sinuses. Do you feel any pain over your sinuses?
My sinuses have been fine.
Okay, that's good to know.
Thanks.
No problem, my dear. Let's palpate the axillary lymph nodes. Palpated bilaterally, no nodes found. Using the pen light. There you go. To the right eye. Constriction of the pupil. Noted constriction of the pupil. But we let it light reflex eyelids check we did that. Let me go down using the ophthalmoscope and checking the eyes and the back of the eyes, the fundus. Holding the okay. Now the left eye. Continuing with the left eye, the fundus of the eye. And it's fine. No swelling, no bleeding. Now we're gonna check the nares. They're pink, patent, no drainage. Right and left nares, the nostrils, inside. Now the inside of the ears. The right ear, the tympanic membrane is pearly gray. 7 o'clock. Alright, tympanic membrane, pearly gray, not irritation, no discharge, no swelling. 5 o'clock. Let's check your eye movements. Okay, Tina, please follow my finger with just your eyes.
Okay.
Right. So up and right, down and right, down and center, down and left, up and left, up and center, and the test of convergence, and we can see, yes, the eyes kind of like want to meet. Visual acuity. To test the monocular vision, let's cover the right eye and the left eye. Okay. Cover your left eye. Please read this line.
FP.
Good. Now cover your right eye. Please read the line.
FP.
Back. Good. 20/20 vision with the corrective glasses right now. Let's see. Tell me, Tina, when you can no longer see my finger.
Okay, I will.
It's 40.
Now.
Okay, that is good. And let's do the whisper test.
4. 4. R. 9. 9.
Let's do the next, the
F.
left ear.
F. 8. 8. W. W.
Thank you. Okay, we are going to do now the cardiovascular and respiratory first. Cardiovascular. We're looking at your legs, checking for edema. There is no edema on your legs. We're going to palpate the carotids. The right and left carotids, no thrill. 2 plus bilateral. Auscultate carotids. No thrill. Bilateral carotid. Artery. Okay, we're going to palpate the upper pulses, the brachial pulse to the right, brachial pulse to the left, present, the radial pulse to the left, and the radial pulse to the right. They are 2 plus bilaterally on the upper extremities. Now we are going to get the pulses to the lower extremities. We get the right femoral, the left femoral, the right popliteal pulse, the left popliteal pulse, left posterior tibial pulse, left dorsalis pedis, right posterior tibial pulse, and right dorsalis pedis. All patent with pulse of 2 plus. Inspecting the anterior wolf. It is no barrel chest, no scars, no pacemakers, no major problem palpating the PMI. And PMI. The anterior chest wall, PMI non-displaced, no hips and no lift. Auscultating the abdominal arteries. We're listening to the aorta, Miss Peyton, no breathe. We're listening to the renal arteries, the right and left, no breathe. Listening to iliac arteries, right and left, no breathe. The femoral arteries, both no breathe. Okay, auscultate the cardiac points. Strong S1, S2 sounding. From the pulmonic, we go to the Erb's point with diaphragm. Tricuspid on the fifth intercostal line, and the mitral area with the diaphragm. Mounting strong, no extra sounds, no murmur, no gallops, no rubs present. Okay. Respiratory. We did the chest. We are going to palpate the extension of the posterior wall. The expansion is symmetric upon respiration. We're going to percuss the posterior wall. Okay. All areas on the posterior chest wall are resonant. The upper, mid, and lower areas. We're gonna palpate for Fremetes anterior chest wall.
99. 99.
Okay. It is positive Fremetes bilaterally on the upper chest anterior wall. Now we are gonna auscultate the lung sounds. Okay, auscultated right and left lower anterior chest wall. No adventition sounds found. All right, Miss Tina, please blow into the spirometer. Very good. FBC 1.78 and FEE 1.549, which is good lung capacity. And we're done with the respiratory. Hmm. We're doing the abdominal. We're going to auscultate the abdomen, the 4 quadrants. Hmm. There you go. All right, very good. Mhm.
I haven't had any problems with diarrhea. I don't have that problem.
Good. I want to percuss left anterior axillary line in the area of the spleen, left upper quadrant, tympanic, all 4 quadrants are tympanic. This percussion sequence will be performed automatically. Okay, the liver span has 7 centimeters MCL on percussion. We're gonna try the CVA for tenderness. And here we go, left kidney and right kidney. No reported tenderness or pain. Neurological. All right. Tina, please run your right foot down your chin. I did.
Sure.
Very good, no deviation. Now the other foot. Run your left foot down your right shin.
Okay.
All right. Well done.
Thanks.
Let's do the next one. Let's check her orientation. Who is the president of the USA?
It's Trump.
Yeah. Where are you right now?
I'm in a doctor's office.
Okay, you told me your name, your age, situation, what you came for. I did that. Alright, assessed deep tendon reflexes to the lower extremities, right patellar reflex, left patellar reflex, 2 plus, right Achilles reflex and left Achilles reflex all present, 2 plus. Testing now the deep tendon reflexes of the upper extremities. Right tricep reflex, present. Right big bicep reflex, right. Now the left triceps, and the left biceps, the tendons and ligaments, brachioradial reflex. It's not coming up. Testing peripheral neuropathy. We're using a monofilament to touch the heel. So, Tina, please close your eyes and tell me when you feel the touch.
Okay, I will.
Alright, we're going to the right and bottom of the foot.
Yes.
Now the left bottom of the foot.
Yes.
No response there. Forefoot under the great toe.
Yes.
Okay. Left great toe. and the right cradle. So the mini sensation to bilateral bottom of the feet, the soles of the feet, to the touch of the monofilaments, mostly felt by the heels. Let's do assessing motor skills. Place your hands over your knees and turn them over.
Okay, like this?
Yes.
Thanks.
Okay, now this one. Tina, close your eyes and touch your finger to your nose.
I can do that.
It's not picking up. Now.
Thanks.
All right, no problem. Tina, close your eyes and tell me what I trace on your hand, on your palm.
Okay. A figure 8.
Yeah.
That's an A.
Yes.
Thanks.
Okay, Tina, close your eyes and say if your toe moves up or down.
Okay, I will. Down.
Okay.
I think that was up. Thanks.
Test the position of sense on both bilateral feet. And now musculoskeletal system, strength of shoulders. Yeah. push against my strength to resist. Lift up your shoulders. Very good. Your strength is 5/5. Hand the strength. Keep your forearms straight and lift your wrist up. Good. Tilt, wrist down. And grasp. Very good. Strength of the wrist, 5/5. Strength of the neck. Turn the neck to the right and resist. Now turn your head to the left and I will resist your movement with my hand. Very good. Now tilt your head to the right and I will receive your movement with my hand. Okay. Testing your head, turning the head to the left and receive the movement. Very good. And last, tilt your head down and I will push your forehead. Try to push your chin against your chest. That's good. Wonderful. Let's see your range of motion of your spine and test it. Bend it back as much as far as you can. Bend over to touch your toes. Very good. Bend from your waist side to side. Good. And now twist side to side from the waist. There you have good range of motion. And last, let's do the range of motions for your knees. Straighten up your legs. Extension, flexion. Raise each knee up to your chest. Very good. Full range of motion for bilateral knees. The spine, let's do the hips. Move each leg out to the side. Now the adductor. Move each leg under the opposite leg. Very good. Extensor. Lying on your stomach, lift the heels towards the ceiling as if you were to be swimming. Mm-hmm. Very nice. Thank you. Okay, I did the hair. Inspect toenails. Nice, clean, round. No ridges, no breaks, no fungi. Inspect fingernails. Round, pink. No ridges, no fungi, no clubbing. I inspected hair before. I don't know. Shh, 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 shh. It's done. Shh. I will do the capillary refills now. Okay. Good capillary refill, less than 2 seconds. Testing each hand. And last one. Back. And the capillary refill to the toes. Very good. Left foot, big toe. Less than 2 seconds. Capillary refill. Next one. There you go. Last one. Very good. All right. It's okay. Tina, we concluded your pre-job screening health assessment. Please remember to keep your diet and exercise be consistent with your medications intake. Follow up with all your medical and routine appointments. We wish you the best in your new profession. professional career. Okay. Where are you? Pum, 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 pum. Period. If you have not yet received the flu vaccine, you might want to consider taking it now. We are starting the season for vaccinations earlier this year. All right, Tina, we are completing this.
Thanks for telling me.
Sure, dear. This has concluded our pre-job screening health assessment. Tina, remember to keep your diet and exercise routine, be consistent with your medications intake, and follow up with all your medical and routine appointments. We wish you all the best in your new professional career. If you have not yet received your flu vaccine, you might want to consider taking it now because we are starting the season for vaccination earlier this year. It's a pleasure starting this class. Thank you so much, teacher, for the opportunity to do it correctly. I had my husband going crazy finding a camera and everything so I can do it. I appreciate your time, and I'm not expecting anything that God puts in your heart. I know I'll deserve it. Thank you. From the bottom of my heart, thank you so much.